Welcome to MTBXP. Today, med kits. So one day I was biking and everything was going fine until this weird little loose over hard turn hit it, wiped out, ate it, bleeding everywhere. So trip to ER and they're talking about removing debris from my wound. All I'm hearing is just $sign, then more $signs, and then more $signs. Got home, everything's been fine, and at that point, my wife extremely advised that to continue mountain biking, I would have to bring along a med kit. So, after a lengthy discussion, I now carry a med kit. So, a lot of the early on talks was about bringing gauze and adhesive tapes and lots of these things that you put together, and I was able to kind of get that list down to something more manageable. Most people, again, after you wipe out, your adrenaline's going, you're seeing lots of blood everywhere. Now whether it's your blood, maybe it's your friend's blood, regardless though, you're just in this weird mode just because you just ate it and you're seeing a lot of things that you're normally not used to seeing. So what likely is going to happen is that kind of the first time that I actually use my med kit, probably in that Fullerton video that you saw with David-1, is that you're gonna reach into this bag with a bunch of stuff and you're just gonna grab the biggest Band-Aid that you can find. And you take this biggest Band-Aid you can find, you're gonna slap it right on the wound, and then you're gonna call it a day, which is fine, usually, but probably not the best solution here. One thing that I highly recommend is that you do practice, because once you do practice, it's like knowing that you're gonna stand up on your bike when you're about to head downhill. It's knowing that you're gonna have to drop post. You don't have to think about it, it's just a reactionary thing. But if you ever go into a situation which you actually have to use it, you're not panicking, you just open up what you gotta open, slap it on, apply it, and then more mountain biking is on the way. Let's get into it. Broke up the med kit into two sections pretty much. Wound cleaning and then bandaging. So at this point, let's see what's inside. First thing is a pair of gloves so that the wound doesn't get touched by your dirty hands or your friend's dirty hands. Next we have wound wash to wash your wound, get that dirt, sand, wood chips, small pebbles out of your wound. So one thing about the wound wash, there's this type which is a squeeze bottle, and then there's this type which is an aerosol can. So this one works great because you can just spray it like spray paint right on your arm, your leg, wherever. But there's one bad thing about it is that you can see denting in the bottle, because I used to carry this in my camelback, and once you fall, put some nice dents in this guy. So nice, but I don't recommend, especially for biking purposes. Stick with the squeeze bottle, a little bit more durable, same purpose. For open wounds that are leaking, non-stick pads. These are better than gauze because these don't stick and hurt when you pull them off. Tweezers to get those splinters, those cactus needles, thorns. Iodine Swabsticks kills a different batch of things than alcohol wipes. So use this on your wounds before putting on a Band-Aid. Have alcohol to clean your minor cuts and scrapes, but the best thing is that it's going to clean the areas so that your bandage actually stick to your skin. Flex wrap you use to wrap the non-stick pad. It sticks to itself, but the great thing is that because it's flexible, you can use it on your elbows, your knees, so anywhere where you're going to have movement, it won't make it slide off and it'll stick to where it is. Some blood stopping spray quickly stops minor bleeding. Traditional Band-Aids just to cover up any kind of small cuts just to prevent infection. Some antibiotic ointment. Use the packets instead of the tubes just because you can rip them open, squeeze them out, and that way you're not getting the rest of the bottle dirty with your hands. There's no sinks out there when we're mountain biking. For large scrapes and scratches, there's Tegaderm patches, which the non-branded name is transparent film dressing. So use these just to keep your cuts and your wounds away from dirt. Last thing is a waterproof bag. Most of the stuff that we talked about here today will not work very well if they're all wet. So kind of a few additional items here as a bonus. You have a whistle just in case you do need help. There's a way to call for it if you're kind of out there in a remote area. And also a basic Swiss Army knife, so nothing fancy, just the cheapest one that's out there available. You got some scissors, knife, tweezers, a toothpick if you happen to need it. A wedge, you can use a screwdriver as a wedge for whatever purpose that you may need, but again, sometimes they come in handy. And the last thing, because why not? Smoke grenade. Because sometimes you're out in the middle of nowhere and you happen to call that $10,000 Huey rescue helicopter, you can pop smoke and they can find you pretty easily. All right, you're probably gonna be in this position after you ate it. Got a nice little scrape right there. So bleeding, you're gonna have to get over the bleeding real quick here. First thing, get your gloves. I do recommend packing those separately just so that you can find pairs fairly easily. Also be able to give a pair to someone else if you do happen to need to. So after you put on your gloves, then the first thing you do is take the wound wash, and then you're going to clean your wound. Take your wound wash, rinse out your wound, and from that point, get all that debris out as best as you can, all the rocks. You can reuse that plastic bag as a trash bag just so that you can leave no trace, which means leave no DNA behind. And then from there, take the iodine, clean off your wound there. You do use iodine if you have a deeper cut. So if it's beyond the surface layer and is bleeding profusely, that's when you're going to use iodine. If it's just a surface scrape, then that's when you're going to use alcohol. So at this point, what I do recommend is prior to putting on your non-stick pad is to rip off, because you're going to be doing this one-handed, rip off a strip of this first, because you're going to need to use this as a helper to keep the pad on. And you're also going to be in a lot of dirt probably, so just again, find a good place to start resting everything there. So again, you just put this on here first. You will probably need the help of your knee or just something to just get that, see how it sticks to itself. Get that on there first. Then once you get that on there, oh man, what I did forget was to put the antibiotic ointment on there first, but hey, you know, you'll forget stuff when you're out there if you don't practice. At this point, you can then loop it around here. So I did it on my elbow because the one thing that you can see is that even near my elbow, it's always gonna be moving, my arm's gonna be moving, but it is sticking. So again, the flex tape is probably the best solution that you have for something near a moving joint. If you do have a scrape, you know, you got some road rash somewhere, or it's just some very surface level scratch, that's when you use this transparent film dressing. So this stuff, again, you just rip right open. You're going to, it's gonna look like this actually, it's gonna almost look like a Band-Aid. You then take off the backside and put it right on wherever you need to put it on. And at this point, you're gonna peel off the top, and then you should be all bandaged up, and now you can go do some more riding. Please like, subscribe, comment below. Thank you for watching.